Ultrasound in early pregnancy, most of us picture biometry, viability, or maybe nuclear translucency. But there's another tool, supple, powerful, and often underused, that can open a window into placental development, cardiovascular function, and even future pregnancy outcomes. That tool is Doppler. In the first trimester, Doppler isn't just about pretty flow signals, it's about predicting complications before they manifest and refining diagnostic accuracy at the very start of pregnancy. Session, you should feel confident about three key areas. First, we will explore how uterine artery Doppler in the first trimester can help us predict preeclampsia and other adverse pregnancy outcomes long before clinical signs appear. Second, we will look at the ductus venosus Doppler and how its waveform gives us insight into early fetal cardiac function and can raise red flags for chromosomal anomalies. And finally, we'll discuss tricuspid valve development, a valuable screening tool that can pick up subcortic and genetic abnormalities at a stage when interventions and counseling matter most. So think of today's lecture as sharpening your Doppler toolbox, moving beyond grayscale and into the predictive power of flow. Before we dive into specific applications, let's set the stage with the basics. Doppler ultrasound measures blood flow and velocity using sound waves. In other words, it doesn't just show us the structure, it lets us listen to the movement. Why does this matter in early pregnancy? Because Doppler provides functional information that goes beyond what we see on grayscale imaging. It helps us detect subtle circulatory changes that might be early indicators of both maternal and fetal conditions. Think of it this way. Anatomy tells us what's there, but Doppler tells us how well it's working. And in the first trimester, that distinction can be the key to predicting and understanding outcomes. Always remember, Doppler isn't just about confirming the presence of flow. The velocity and waveform pattern often carry the real diagnostic value. Uterine artery Doppler and its role in predicting preeclampsia. This technique is fairly straightforward, but precision matters. At 11 to 13 weeks, you can use either a transabdominal or transvaginal approach. The key is to identify the uterine artery at the point where it crosses the iliac artery. That's your landmark. Once you've got it, record the flow waveforms and calculate the pulsatility index or PI. A higher PI in the first trimester is associated with impaired trophoblastic invasion and can signal a higher risk of preeclampsia and related complications later on. On the screen here, you see a normal uterine artery waveform at 36 weeks, smooth, low resistance, and a high good reference point for what healthy uteroplacental circulation looks like. When you're scanning in the first trimester, don't be tempted by to settle for just finding the artery. The reproducibility